3-year-old Nigerian toddler, Annabelle, knows about the coronavirus and its symptoms.
Tell me what you know.
I know coughing. And I know sneezing.
Are they bad?
Yes.
The Nigeria Center for Disease Control issued an advisory to schools across the country on tips to prevent the spread of the virus. Regina Jamide, head of the Riverbank School located around the commercial hub of Lagos, takes us through how the school is implementing these measures and the cost implications.
I honestly think that this was a very good initiative by the government. I know that a lot of private schools may be aware and may do these things, but you know, when you have schools in all parts of Nigeria doing the same thing, and you know, and implementing the same thing, then you are sure that, you know, we are joining hands with the government to fight the virus, making us a bit more aware of what the virus is and making the children, most importantly, more aware of what this virus is and how they can protect themselves. First of all, we send an email to the parents, informing them about the fact that they were not going to be allowed to drive into school. Secondly, we asked that if the children were ill, they should keep their children at home. Not just one child, but if they have 2 or 3 other children in school, all members of the family stay home for 2 weeks, just to ensure that, you know, everyone is safe. And on returning to school, I needed a medical certificate signed and stamped by a pediatrician, just to ensure that they are well and ready to come back to school. Thirdly, we got medical personnel to stay at the gate to screen everyone coming into school. When I say screen, they're screening the staff, they're screening the children, and they're screening the parents as well. We stopped all our assemblies. We stopped our swimming classes because we just want to be sure that all the children are safe. We want all the children that have been picked up to go home immediately because we don't want any loitering. And of course, when children are ill and they can't come into school, there are online lessons that, you know, we have put in place so they don't miss out anything academically. We want to be taking the temperatures, you know, we just want to see that everyone coming into school is healthy and safe and ready to learn.
And how did the parents and maybe by extension, or more importantly, the children respond to all these measures? Because I realized there was a bit of a walk getting to the school from the main gate.
I would say the children responded well. Quite a number of our parents responded well because they were happy that the school, you know, was doing something to ensure everyone was safe. You know, logistically, it was a bit challenging for the parents, especially when, you know, stopping all the parents from driving into school, spending 10, 15 more minutes in traffic, you know, because of the new parking area we had. But basically, I think everyone responded well.
Regina maintains it's not all hard news. Some positives have come out of adopting stricter hygiene policies to fight the coronavirus. So clearly that's a whole lot of change considering the measures you had to take off the back of the confirmation of the coronavirus case. So for you, have there been any positives as a school?
Yes, a lot of it. The children are a lot more aware of the fact that, you know, about their personal hygiene. Illnesses have reduced because, you know, no child is coming into school with a cold. If you come to school with a cold or a slight cough, we send you back home. You know, so I think everyone has generally been healthy, you know, in school because of, you know, the structures we put in place, you know, for the personal hygiene. The children have learned how to wash their hands properly. The children can tell their friends and other teachers, you know, to sanitize their hands, to wipe the surfaces before putting their hands on the table, to wash their hands after putting their hands on the table. I think, you know, it's been positive all the way.
The preventive measures that you have had to invest in, what have they meant for your finances?
Oh, a huge dip in our finances, you know, getting, employing, you know, more medical personnel, you know, getting hand sanitizers, which these days is very difficult to find. We see ourselves importing hand sanitizers now, you know, just ensuring that we have the right thing.
With contact tracing efforts still on in Nigeria and more suspected cases still being quarantined, it looks like this will take a whole lot of time than earlier anticipated. It's taking more time globally, clearly. To what extent do you think you will be able to sustain preventive measures that you continue to invest in as a school?
I guess we don't have a choice but to continue to do what we are doing now, even after, the end of the coronavirus in Nigeria. I guess we will still continue with some of the structures we've put in place. Just continue to teach our children to wash their hands all the time, to sanitize their hands all the time, and to keep themselves healthy.
In the last couple of weeks, Nigerian authorities have adopted many channels to pass credible information and updates on ways to contain the virus, from press briefings to jingles and social media.
Healthcare workers are also regularly sensitized to continue to have a high index of suspicion for the COVID-19 virus disease. Working in collaboration with the Guild of Medical Directors, we have conducted training on infection prevention and control for representatives of the private health facilities. Citizens are advised to discourage spread of misinformation that causes fear and panic.
The latest effort is a dedicated microsite for timely dissemination of facts and progress made by the NCDC. Disruptions caused by the coronavirus outbreak have threatened global oil demand, and the markets witnessed the biggest one-day rout in nearly 30 years after OPEC's failure to strike a deal with its allies regarding production cuts caused Saudi Arabia to slash prices. On the impact on the global hospitality sector, the International Air Transport Association says airlines could lose up to $113 billion in revenues this year, with African airlines risking about $400 million in losses by conservative estimates.
So China is particularly badly affected. Other countries are having a reduction in travel. You hear the airlines reporting that their load factors are down. People are scared of traveling. People are scared of going to a destination and then being quarantined and stuck there for a long time, which if you're on a business trip 2 days, you don't want to be there for another 14 days. That wasn't the plan. So there's that fear. What we're seeing here in Nigeria, being specific, is that the domestic traveller is less affected than the international traveller. We're seeing a reduction in the number of international travellers. The hotels which are well managed are going to be ready, because they went through Ebola. Ebola was in 2014, a terrible, terrible tragedy in West Africa. And the hotels had procedures in place.
A total of 27 people have been screened for COVID-19 across 5 states in Nigeria: Edo, Lagos, Ogun, Abuja and Kano, out of which 25 tested negative and have been ruled out.
From information on news is very encouraging, because almost every state now is getting ready to be able to tackle the spread of the disease. And I believe that should be done as if the case was in their state yesterday. So any state that has not joined that should begin to do so.
A multi-sectoral emergency operations center led by the Nigeria Center for Disease Control continues to coordinate national response activities. And the national rapid response teams also are supporting both Lagos and Ogun states with the contact tracing and other response activities.